Today we are going to cover high yield points and common exam traps related to these disorders so that you don't miss any questions. Criterion A is exposure to actual or threatened death, serious injury, or sexual violence. This can be either experiencing it directly, witnessing it, or learning of events occurring to a close family member or friend. In order for a person to meet criteria for post-traumatic stress disorder, they must meet that Criterion A definition of trauma. But they must also meet the requirements of these other symptoms in order to meet criteria for PTSD. They must have at least one or more intrusion symptom, which can be recurrent, intrusive, distressing memories, recurrent, distressing nightmares, dissociative reactions such as flashbacks, and intense distress reaction to external cues or internal cues. They also must have at least one or more avoidance symptom. So that can be avoidance of distressing memories, thoughts, feelings, avoidance of external reminders such as people, places, conversations, objects, situations. There also must be at least 2 negative cognition requirements. This can be dissociative amnesia. They can't recall accurate events of the trauma. There's persistent negative beliefs about themselves or the world. There's distorted blame of self or others. And there's lack of interest, detachment, no positive emotion. There also needs to be at least 2 hyperarousal symptoms. So this could be hypervigilance, exaggerated startle response, irritable behavior, angry outbursts, sleep disturbance, such as difficulty falling or staying asleep, and problems with concentration. Now, PTSD and acute stress disorder both require trauma exposure by the definition of Criterion A. They both require post-traumatic symptoms that we just talked about. So how are you going to distinguish between them on the exam? Because they will both show up on the answer choices. And the answer is the duration. It's all about timelines on these exams. Post-traumatic stress disorder has the duration of symptoms for at least 1 month occurring after the trauma. It can be delayed onset, but again, these symptoms need to occur for at least a month. Acute stress disorder, on the other hand, has an onset within 1 month of the trauma, and the duration can last from 3 days to 1 month. After it hits that 1 month, it becomes post-traumatic stress disorder. They have the same symptoms, it's just for a shorter duration. Again, these are the key differences, is the timing and duration, nothing else. A lot of people who have acute stress disorder end up getting diagnosed with PTSD, but it does not become that diagnosis until you hit that 1 month mark. Remember that for the exam. So how do we manage PTSD? This will definitely show up on your exam, so it's important to know. For pharmacotherapy, first-line treatment is SSRIs, such as sertraline, or SNRIs, such as venlafaxine. For nightmares, prazosin can be used. Prazosin is an alpha-1 receptor antagonist, which is FDA approved for nightmares and PTSD. They've also found that prazosin can be used twice a day to help with hypervigilance that people with PTSD experience throughout the day. For therapy, trauma-focused CBT, exposure therapy, and cognitive processing are all great therapies. If they show up on the exam, those are the correct answer choices. EMDR and ART also can be used for PTSD management. It is important to know to avoid benzodiazepines. They have a high risk of addiction, and people with PTSD commonly end up with substance use disorders because they use substances to help cope with the past trauma, and adding benzos just adds another thing that they can become addicted to. It also interferes with processing of trauma, and it can worsen dissociative symptoms. So don't give someone with PTSD a benzo. So next we're going to talk about adjustment disorders. Adjustment disorders actually recently got moved to the trauma section of the DSM in the newer versions of the DSM. They are emotional and behavioral symptoms that develop after non-life-threatening stressful life events such as divorce or loss of a job. So it can greatly affect the patient. They just don't meet Criterion A for the psychiatry definition of trauma. The symptoms will develop within 3 months of the stressor, and then they resolve within 6 months after the stressor terminates. So these symptoms are not going to keep going on and on and on after the stressor goes away. There are multiple subtypes of adjustment disorders. It can be with depressed mood, with anxiety and depressed mood, mixed disturbance of emotion and conduct, and then mixed emotions and conduct. They're going to use these subtypes to trip you up on exams. So say there is a person who is going through a nasty divorce. They come to their doctor and they're very tearful. They're feeling very down, depressed. They're maybe having difficulty concentrating. They're having poor sleep. And you think that this might be a depressive disorder. Well, if they're not meeting criteria for MDD and they've recently had a stressor that they're still experiencing, this is probably an adjustment disorder, not MDD. Now, if the person is going through divorce and they actually meet full criteria for MDD, like the SIGI caps, then the diagnosis is MDD. Treatment for adjustment disorders is primarily supportive psychotherapy, group therapy to address the stressors, and of course, CBT to help with coping. More high-yield videos, click on the playlist on the right. That's all we have for today. Good luck on your exam.